for joining us for today's campus update briefing. Live from our beautiful campus here in beautiful Tucson, Arizona. I'm Holly Jensen, Vice President of Communications. As always, Dr. Robert Robbins, President of the University of Arizona, is going to provide you important updates on the university's operation. And as always, he's joined by Dr. Richard Carmona, 17th Surgeon General of the United States and Distinguished Professor here at the university. He's going to provide updates on the current state of the Delta variant and our public health conditions in the county, state, and here on our campus. We have a very hard stop time of 9:30 today. So we'll take your media questions at the end of President Robbins and Dr. Carmona's remarks. Into the panel when you raise your hand, and I'll call on you in the order you do so. With that, I'll turn it over to you, President Robbins.
Thank you, Holly, and good morning, everyone. Thank you for joining us. We're 1 week into our fall semester for most students, and it's been really great to see the campus come back to full capacity and a lot of excitement. We continue to monitor public health conditions here on campus and in the surrounding community. Local area hospitals and other healthcare providers continue to face challenges due to increase in COVID-19 cases. Basic public health measures like getting vaccinated, wearing a mask, and testing regularly remain our best way to minimize the spread of the virus and increase the capacity of our healthcare system. I want to reiterate, we are requiring masks to be worn in all indoor spaces where adequately and continuously maintaining social distance is not possible. We expect you will follow posted signage on required or recommended mask use in each space. And I'm happy to report a week into this that there's been great compliance on the masking requirements. Our testing capacity remains very high, and I want to thank the incredible team that has stepped up to run this initiative, as well as those who have registered and had tests administered this past week. Remember, last year we did a great job on testing, tracing, and treating, and we have that at our disposal again this year, and we'll use it to its full capabilities. Members of campus community who have not yet done so, please visit covid19.arizona.edu for information on how to register and make an appointment. Campus Health is also providing the COVID-19 vaccine by appointment to all university students and benefits eligible employees. If you're fully vaccinated, please consider uploading your vaccine document to our secure HIPAA compliant system. Visit vaccine.wellcheck.arizona.edu. It's really easy to do. Just take your card and you can download it, and that would be of great benefit to us. As a reminder, we're offering incentive for students and employees who upload their vaccine documents. As I've said before, our goal this semester, just as it was last year, is to provide a rich educational experience for our students. We're taking these steps to minimize the impact of COVID-19 on the campus community and in the surrounding communities. I also want to note the potential impact of recent events in Afghanistan and express my support for our students with ties to the region, whether family relationships or from service in the military or foreign service. I know many of you have family, friends, and colleagues who face considerable hardship and danger, and I know you're concerned for their safety. For our military-connected students, please reach out to the Vet Center if you need support at this time. Visit vets.arizona.edu or write to vetsofc@email.arizona.edu to connect. Students, faculty, and staff with family or other ties in the region, please use the mental health resources available in Campus Health or Life and Work Connections if you are in need. Visit health.arizona.edu or lifework.arizona.edu. Additionally, I want you to know our federal relations team and Center for Middle Eastern Studies are working closely with the State Department, members of the Arizona Congressional Delegation, and U.S. military forces to assist in the relocation of families of Afghan nationals with ties to the university. Several families have visas already being processed. If you know of other refugees who need assistance, please reach out to our federal relations team to help coordinate our efforts to elevate these cases. Dr. Carmona will now provide an update on the cases in the epidemiology and public health situation. But Rich, when you're finished, I want to come back to not only do we have crisis around COVID and the incredible heartbreak going on in Afghanistan, but I think yesterday was like the 15th anniversary of the landfall of Katrina, and I know you were intimately involved in that. And so we also want to keep all the people in New Orleans, Louisiana, and the southeastern United States in our thoughts. So, Rich, I'll turn it over to you.
Thanks, Bobby. I appreciate it. Points well taken. First slide, please. So as we have done for the past year plus to give you some averages of what's going on at 7-day rolling averages, you can see Arizona is doing fairly well. We're 23rd nationally. Florida is, at the worst possible. California is at 34. Pima County is doing well. But even though these numbers would imply that we're doing okay, we really aren't, because as we look at the state and we look at about 9–10% bed availability, 9–10% ICU beds available, and we look at where the trends are going, school has started, lots of admissions of children now to hospitals to be hospitalized and to be seen for upper respiratory infections. So we see the trends going in the wrong way. We also see that, again, as you've heard many, many times, our staff are just so tired. The mental health challenges around this, and our frontline workers who have to go home every night and see their families, who are extremely worried about spreading this variant, are there before us. So the numbers show that we've done a pretty good job in Pima County and on the university, but in the larger context of our state and our nation, there are some challenging times ahead of us. Next slide. And if you look at our testing results, we've talked about these numbers. We were in the beginning to staying below 5%. We're doing real well. We're very early in this. So again, we don't want people getting complacent because the numbers look good. This is just the beginning. We anticipate that as we move forward around the fact that summer is ending, Labor Day holiday, everybody's getting together, people are traveling, snowbirds are coming here, flu season beginning, the combination of all of those things make it extraordinarily risky. And we see the possibility of another surge because of that. Next slide, please. We look at our transmissibility rates, the RT values. As you can see, the zip code 85719 is where we are at the University of Arizona, and then the county, and then in Arizona at just below 2. Not where we like them at the state level. And unfortunately, we believe that these are going to continue to trend up for all the reasons I've already mentioned. But at least now it shows we've done a pretty good job here in Pima County, and especially around the university, as based on this number of about 1 for transmissibility. Next slide. These numbers are pretty good as it relates to vaccination rates, especially for the seniors above 65, and for the total for Pima County being 63. Our total state is a little over 50%, and that's where we are as a nation as far as people being fully vaccinated. The other side of that story is almost half the country is not vaccinated, which means we have potential vectors out there where the virus can go, where the virus can continue to mutate and provide further variants that can cause problems for us as we move forward. So although the numbers are looking better, most of us are still staying out at night, long hours. And I know, speaking with the president, 24 hours a day in our incident command system, these are troubling times. The good news is I think we've done a pretty good job in Pima County. The bad news is that all of the predictions show it's going to get tougher before it gets better. Next slide. So we've done a number of incentives, and this is the same we reported last week, and this is to encourage people to get vaccinated. We're doing everything we can within the limits of laws that have been passed in the state of Arizona to inspire people to do the right thing, not only for you, but for your family, your community, and the nation. Because if you can be protected, you protect those around you as well. So it's so important that everybody gets vaccinated. Next slide. The mitigation efforts, we covered this last week as well, and we are looking at every possible way to keep the campus safe and clean, to be able to allow our students, faculty, and staff to come back in a COVID-free environment. The numbers on our campus as it relates to positive hits in labs and such are very, very low, and we have teams right there. So we've reduced, our risks significantly. The mitigation efforts on our campus have been working very, very well over the last year and a half, and we'll continue to do so. But we need all your help as well to get vaccinated, mask up where appropriate, wash your hands, and do everything you can with the public health guidelines that are out there from CDC and the Pima County Health Department to keep us safe. Next slide. So the mitigation efforts, again, thousands of things have been done, as you can see there, and we're going to continue to do those. And interestingly enough, every day, as we discuss with our public health advisory team, our scientists on campus, our doctors, our immunologists, we're always looking to find different ways, innovative ways, disruptive ways in our environment that we can even bring more mitigation efforts in to stop the spread of infection. So just by showing you these, I want to show you how hard the team has been working. But that doesn't make us be complacent. We are still always asking each other questions, pushing each other to figure out what else can we do to make this environment safe. Next slide. So any questions, of course, we have our COVID Ambassador team line, and that's available to you all the time, 7 days a week. So please look at these numbers and email should you need the information. Next slide. So Bobby, per your points as we started, I am extremely concerned not only with the challenges in the Middle East, the stress that it's causing, where families have connections, loved ones who are serving in our uniformed services in the Middle East. And then you have our Southeast, where we're seeing what we went through with Katrina happen once again. There's no power, people are struggling. We're rapidly trying to move resources down there. And then you layer COVID on top of that. What we often forget is the mental health challenges of all of this. It is so devastating, besides the obvious that we report all the time, but just the mental health challenges of a nation that's really struggling every day to preserve its democracy and try and keep people healthy and safe. And yet, unfortunately, it's in some cases being divided by bad messaging and confusing people to what really needs to be done to make our nation healthy and safe.
Yeah, I think we could talk a lot about what needs to be done. I'm really focused on testing. Whether you're vaccinated or not, I think you should be getting tested frequently. I would love to see us, everybody in the university community, come and test at least once a week. I'd love it to be twice a week, but if you could come by and just get a test once a week, and to be clear about it, if we didn't have the state law prohibiting us, then I think it would make our jobs a lot easier. To just mandate vaccines, mandate testing, even if you are vaccinated, and mandate masks. We know those are great, effective public health measures. But we've got to deal with the reality that we have right now. And we're in a better place than we were last year. With test, trace, and treat, in the trace part, contact tracing, I can't say enough about the team that's been doing incredible work behind the scenes to contact trace all of those positives that we identify. But we need more and more testing. So I'm appreciative to Jane Hunter, her entire team, for ramping up the testing to get back to where we were. I think, Holly, we're trying to hit at least 3,000 tests a day, which is a little more than we did last year. But we have that extra net. We're walking a tightrope. Last year, we were doing it without a net. At least this year, we had the net of the vaccine. So I'm really imploring, begging, incentivizing, doing whatever we can short of requiring vaccination, because as Rich said, it's the only way we get out of this.
A total of the students of 1,200 on Friday. And the good news is campus.
That's
And we'd
great.
also, and at your direction, you know, we're adding more testing capability. We've added rapid antigen testing for our dorm students, and pretty soon we are going to have takeaway testing for the saline gargle that'll be available for off-campus students and our employees on campus. So we are getting back into that rhythm and trying to make it incredibly as easy as possible for those who do want to get tested weekly. The other thing that I think is really important to note today is that now our designated campus colleagues can also get vaccinated at Campus Health. So anybody who is considered a DCC here on campus can go to health.arizona.edu and register to get vaccinated immediately.
Hey, Holly, I think it might be worth mentioning also what the president just emphasized and you have said about testing frequently. And we've had questions where people say, yeah, but I'm vaccinated, so I don't need to be tested. No, you need to get tested as much as you can, because we know that even though you have been vaccinated and you may be protected from getting serious disease, you can be carrying the virus and spread it to other folks. So we want to know if you're carrying that so we can take you out of circulation for a while so as to not infect others.
Holly, we should probably go to questions because we have limited time, unfortunately, today.
You're right. Our first question comes from Kagan 9. I'm assuming it's Craig Smith, but I have not confirmed that yet. So go ahead.
Yes, it is, Craig. I'm going to ask you guys for a two-for really on two very different subjects. For Dr. Robbins, on your mention of Afghanistan, please elaborate on what the university can do for people who are trying to escape and come here. And when you're talking about visas in process, does that suggest those people have already made it out of Afghanistan or are in some intermediate spot? And for Dr. Carmona, I'm interested in a little more on your new role with the state, how it may affect your role with U of A, and how do you persuade more people to get vaccinated when medical arguments don't seem to be persuasive for them?
Yeah, so Craig, thanks for being here and leading off as you usually do. I'm going to defer to Holly, who used to be the spokesperson for the State Department, the U.S. State Department, about what we can do as a community. I do know that as I said in my opening remarks, we're working behind the scenes with our federal delegation, the State Department, everything we can do for our students, our faculty member, our community members who have individuals in the region, either trying to help them get out, and once they get out, then helping to process their visas. Holly, any more insight you have on that?
Yeah, you're exactly right, President Robbins. Our government and community relations team based out of here and our team in Washington are directly working with the ambassadors and our federal legislatures to identify anybody that has an affiliation with the university and provide those names to those people inside Afghanistan who are evacuating them. And that's not just our university. That is happening countrywide. There are swaths of people that are helping identify and target those people so that we can get them safely to the airport. I mean, time is running out. I think today is the 30th. Tomorrow is our deadline. So we're asking anybody who may know of somebody who is stuck inside Afghanistan to please reach out to our government and community relations team. You can also reach out through our vet center, and we will get those names added to the list to try to get those people out.
Rich, you want to comment? You didn't have enough to do. And by the way, I just want to point out, Rich, you know, I know you served our country valiantly and were wounded in Vietnam, and this Afghanistan thing reminds me of, you know, I had a friend who I went to medical school with who was in his senior year of medical school, in Saigon. And he had to come, he got airlifted out on one of those helicopters off the roof of a building. And he had to start back and take courses at an undergraduate level. So of course, everybody wanted to study with him because he had already done physiology in medical school using Guyton's textbook of physiology. And so he was great for us because he already knew this stuff, but he went on to get his MD degree and serving rural Mississippi. And so Rich, tell us about your new role.
Well, thanks, Bobby. The governor reached out and we've had a number of conversations. And as you know, over the last year, we've had conversations between him and I, Dr. Christ, who just left. And Dr. Christ, of course, was one of our former students at the U of A, who became health director. Now she's going into the private sector. And the governor asked if I would have some time to assist him and his team in looking at better ways to get people involved to get vaccinated and so on. And so we had a number of discussions and I said, sure, I'd be happy to. So I took on the position as his policy advisor, essentially assistant. You know, basically, I'm another source of information that will help the governor and the team make decisions that are on behalf of the state. And fact is, you know, we'll disagree on some things, but that's okay. I think the governor are lockstep in the fact that we must do everything we can to get everybody vaccinated, and we must encourage people to move forward and accept any and all public health mitigation strategies that are relevant to your community based on your public health department, your leaders in your community. And so we're in the process of putting together a strategic communications plan, working with businesses, because what the people have to understand, this is more than just health. This is about the prosperity of our economy. This is about keeping our businesses open. This is about filling our football teams, stadiums, and our basketball teams. And we can't afford to shut down again. This was devastating this last year, the unemployment rate, the debt we've seen. So we want to educate the people as to the bigger picture, that by getting vaccinated, you're not only helping to preserve health in our state, but help to preserve our economy. And the fact is, Arizona is growing very rapidly. There's a lot of places that people are leaving. The taxes are too high. It's tough to live in those places. They like to come to the nice weather here. And we want to make sure that this economy continues to be vibrant and our people continue to be healthy. So I've agreed to work with the governor and his team to, again, do all we can to inspire people to do the right thing, get a vaccination and adhere to the appropriate public health mitigation strategies, which will help to extinguish this virus as quickly as possible.
Can I just add one more thing? I think in my remarks, I said, you know, the deadline is tomorrow for the evacuation out of Afghanistan. That does not mean that the work that we are doing behind the scenes to identify Americans and or the people who helped our American citizens and want to leave Afghanistan, that does not mean our work is ending. We will continue to do that continuously in coordination with our federal and local and state officials to make sure that we get as many people out of there as we can. And I think Craig has a follow-up. There you go. Go ahead, Craig.
Yes, for Dr. Komodo, when you were saying that, it sounded like effectively saying, well, we're going to agree to disagree, and you were talking about effective public health methods. Does that essentially mean you're going to agree to disagree about masks and mask mandates?
Well, Craig, I'm glad you asked that question. It's an important one. I think the nation and our state has been divided too long around political issues that really aren't beneficial to improving the health of our state. Arguing over a mandate when the legislature has already passed a law, well, there are ways to deal with that. You know, people have the right to vote and do that. So I'm not saying I agree with them. What I'm saying is we've got to move on past a political debate. We need to inspire people to do the right thing. There is no restriction for people who are well-informed to make the right decision to be able to get vaccinated and adhere to public health guidelines. That's what I'm talking about. I don't want to be involved in the political discourse that's been so divided and divided our nation into a disunited United States or a disunited state. This virus kills Republicans, Democrats, and independents. What we need to do is come together as a state and a nation to eradicate this virus so that we can move forward. And that's where I'm going to put my time, and the governor is also, and we are lockstep in that. And we are joined at the hip, so to speak, because that's what we have to do. I applaud everybody for, as Bobby has said, in a perfect world, getting the latitude to do much more. And that's not to say the public shouldn't still, if that's what they believe, do that. But for now, we have to stay focused on the mission. And the mission is get everybody vaccinated and use the good public health guidelines that we know. That's the safest way to recover from this virus expediently.
All right, our next question comes from Megan McNeil at KOLD. Go ahead, Megan.
Holly, in the interim, I've got to head out. So just want to let everybody know. And if there's other questions from me, I'll get them from you later. Okay. Thanks very much.
Thank you.
Thanks, Bobby.
Go ahead.
All right. See you.
Sorry, I just got the prompt there. So just quick question. I know y'all were testing the wastewater to see if there were any positive hits and then isolating students. Have y'all found any positive hits within the wastewaters of the dorm? And have you isolated any students? If so, how many?
Yeah, we've had some, you know, as you can imagine, over the summer, it was pretty low. And we have had a few dorms where we've gotten weak signals and sort of moderate signals. So a lot of the testing that we did this weekend was based on wastewater testing, even though it was sort of a weak signal in one of our bigger dorms and sort of light to moderate in a couple of the others. We found no positive tests. Now, one of the reasons is because we could not mandate and require everyone to be tested. But we feel pretty comfortable if we get a really strong, hot signal out of one of the dorms. We feel that in working with the state and having Dr. Carmona as part of advice, when we get a really, really hot signal from wastewater-based epidemiology, we're going to plead our case vigorously to DHS that we will require everyone in that facility to be tested. And if they're positives, then we will do a great job of contact tracing all of their contacts. So we have not seen any large spikes in any groups of dorms, but you know, we're in early days, and I am anticipating fully that we're going to see a bump in cases. Just one weekend, we haven't seen it yet, but it's coming, and we need to be prepared for it.
As for the number of people that have been in isolation, Megan, the last number I heard was 4 in isolation last week, with 3 being released at the end of the week. So I can get you the most up-to-date numbers. I'll follow up with you directly. And with that, President Robbins, we have hit the 9:30 mark. Closing remarks for you.
Yeah, I mean, I know there's got to be other people who have questions. Is there one more burning question? I don't know.
Let's see. So far, nobody's got their hand up. I think you may have answered everybody.
Well, that's not possible to answer everybody, but we lost Dr. Carmona early. We had a few auditory difficulties with your mic, but Holly, it got fixed. Arlene, you're doing a great job back there behind the scenes. So
she was working on it.
I just want to remind everyone, this is really, really important. You know, I've spent a lot of the last week talking to concerned parents who call and say, would you be willing to just talk to my students? Because I'm having a hard time convincing them. They feel invincible. They feel like I've already had COVID. Can you talk to them about getting vaccinated? And no matter if you're young and you do feel invincible and you've already had COVID, get a vaccination. We're going to be at this with this Delta variant, and then with Lambda coming and Epsilon and whatever the next variant is going to be. If we have half of our country that's not vaccinated, you can count on it. You can absolutely bet on the fact that we're going to have more variants, hopefully not as nasty as Delta, because Delta is a very clever mutation. It is so much more contagious. And so I'm just, again, begging people. Last year, we were begging them to get tested, get tested. Now we're saying get vaccinated and get tested. And please wear your mask. So with that, I would say vax up, mask up. Got my vet's mask on, if you can see that. And as always, bear down, and we'll see you next week. Have a wonderful week.